Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello, and welcome to the latest episode of the POMA Does podcast series, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Dr. Patrick F. Leary, DO. I am a clinical professor of family medicine at the Lake Erie College of Osteopathic Medicine. I'm board certified in family medicine. I have a CAQ in both geriatrics and sports medicine. And I've been practicing for nearly 43 years now. As we enter the season of fall, we're going to talk about falls and fall prevention. September 22nd, I believe, is the first day of fall. So no pun intended, but falls are important. Falls are costly in dollars and quality of life. Today we'll explore the patient populations most at risk for falling, the impact falls have on the healthcare system and their quality of life, some of the risk factors for falls, and how to work with patients to prevent falls and keep them safe. This podcast episode is eligible for CME credits, and to claim your credits, we'll note it on the webpage episode description to visit the POMA podcast page on the POMA website. Podcast episode was developed entirely by POMA. None of the speakers or planners for this episode have any conflicts of interest to disclose. Now let's get started. The objectives of today's discussion are to discuss the nature of falls and identify the changing aging demographics, to emphasize the exorbitant financial burden of falls, to discuss issues of prevention and reduction, because we can't prevent falls, but we can certainly reduce them, the number. Implement safety analysis, and finally know the resources that are available to assist us. So I always like to start my discussions in the form of TED Talks about what is it that we're going to talk about, and then at the end, the now what. So the what of my discussion is that there's 36 million falls per year in the population of folks that are 65 years or older. 36 million. Of that, 1 million hospitalized yearly as a result of a fall. That leads to an estimation of $74 billion in yearly costs for falls by the year 2030. Coincidentally, that's about the same time when our aging population will be almost 1 out of 5 people will be over the age of 65. So there's a $6 billion direct cost from hip fractures, which we'll discuss as one of the deleterious side effects of falls. 20% of falls lead to fractures, concussions, and other serious injuries. Interestingly enough, women fall more often indoors and men outdoors. This becomes important as we discuss the nature of these falls. Women have more hip fractures because of their postmenopausal osteoporosis. 95% of hip fractures come from falls, and there's a little over 300,000 hip fractures per year, with 90% of those receiving surgical extirpation. Hip fractures result in high percentages of mortality. Some estimates, and things are improving in that, but some estimates say 1 out of 5 over the age of 65 that have a hip fracture will end up succumbing to that within a year. So again, women indoors, men outside. The so what of this discussion, the men die from falls because they're usually higher, a greater depth of fall. Women fall and fracture more than men. So again, men outside, women inside. And the interesting thing and important in our discussion is if you fall, you may fall again. One fall leads to another, and the fear of falling is a risk factor for falling. It's a great expense to our over $4 trillion healthcare costs presently. The aging population, which I alluded to, people over the age of 65, and I, of course, am one of those people, that population will rise to approximately 22% by the year 2040. So estimates are that 1 out of 5, more than 1 out of 5 individuals will be over the age of 65 in another 15 years. 3 million emergency department visits yearly attributable to falls. 1 million hospitalizations yearly, which are, of course, very expensive. So coming to the rest on the ground are usually broken down into 3 different categories: the intrinsic, the extrinsic, and the miscellaneous, which is medications, alcohol, and over-the-counter drugs. And we'll break that down. The intrinsic factors that are important, as I have just discussed, is age. The older you are, the more likely you're going to fall. Females, again, the osteoporotic bone quality of women make them more likely to break their hip when they fall. Associated with the intrinsic factors are difficulty as we age in hearing and vision, which we will discuss a little bit more later. If you've had a previous fall, we sometimes will give people a pass if they fall once, but if they fall twice, they're considered a faller. Abnormal gait, anything that leads to that, including medical illnesses, diabetes, cardiac problems with arrhythmias, and neurologic disorders. Mental health issues have also increased the social climate and contribute to a greater propensity for falling. Any type of foot problems that develop muscle weakness. And again, as I said earlier, the fear of falling is a intrinsic risk factor for falling. The extrinsic factors are uneven surfaces, stairways, lighting that's not appropriate, shoe wear, the snow and ice of northern climates, tripping hazards, and hidden tripping hazards, such as sometimes sundry of pets that people have these days, slippery floors, uneven steps, and just generalized clutter. And we will discuss the safety analysis that's available for occupational health specialists to come into a home and to help declutter a home of someone who's been hospitalized for a fall. A busy slide that has a lot of great information on it. Again, it breaks down the extrinsic factors of poor lighting, glare from lamps, no personal aid equipment, unfavorable flooring, loose carpets, uneven and slippery floors, low-lying objects, obstacles, electrical cords, steps, hedges, and low-lying furniture. Slippery shoe wears. Everything has to do with good footwear when it comes to extrinsic factors. The intrinsic factors, which again play into our role as primary care physicians, diseases which alter the gait and mobility such as Parkinson's disease or knee and hip arthritis, again, foot problems and neuromuscular and vestibular diseases that might make it more likely for you to have a seizure or dizziness. Several medicines have been earmarked as very poor for falls, and that includes sedatives and some of our cardiac drugs. Visual impairments as we age are ubiquitous: cataracts, glaucoma, macular degeneration, and certainly retinopathies. Getting up quickly when taking cardiac medicines or dehydrational status of hypotension, orthostatic hypotension, cardiac issues, and or postural causes are a huge reason why people will fall after rising from a seated position. Again, that increasing age percent of the people will be over the age of 65 in the next 10 to 15 years. Situational factors can't be ignored either. Walking while talking, which we all do with phones, being distracted by our multitasking busy society, failing to notice an environmental hazard such as something as simple as a curb or a step. That's a big one. Again, playing into balance and vision issues that, I didn't see the curb or I didn't see that last step. Last step of basements. So a one-story home is a great thing to have as you age so that you don't have to worry about those steps tripping you. Rushing to the bathroom, the urgency, some of our urinary difficulties as we age, both men and women, especially at night when we've been lying supine or prone and get up. There's darkness there, there's clutter, there's urgency, and there's orthostatic contention. Or just rushing to answer the telephone. Nowadays, we carry our phones with us, which is also a good and bad distraction. So the medications, benzodiazepines are the enemy of falls, so we try to limit their usage. The SSRIs, again, have some orthostatic difficulties associated with them. The tricyclic antidepressants are high on the list. Narcotics, of course, can cause lightheadedness, dizziness, and a propensity to fall. Aspirin, antihypertensives, alcohol are related. And over-the-counter medications are numerous that can contribute to postural changes. Other risk factors, as I've emphasized, previous falls, and sometimes I repeat myself, and some of it is senility, but most of it's for emphasis. I always like to say that when I tell stories over and over again. It's not because I'm developing dementia, it's because I'm trying to emphasize certain things, so bear that in mind. Visual impairments, you can see I wear glasses, and I have since I was 2, so having good shoe wear and having good glasses and being able to hear, these are all things that help people prevent falls. Muscle weakness is a big indicator of poor balance, and sometimes people have vascular difficulties or transient ischemic attacks, arrhythmias from coronary artery disease, seizures. Again, alcohol usage can not only cause its own ability to trip or fall, but when used synergistically with medications can cause a hypotensive problem. Medication side effects, one of the biggest ones in all medications is orthostatic hypotension. Any formal balance disorder or informal balance disorder, any gait disturbances or hidden tripping hazards, which again include the things that you don't see because you don't have good vision, or you can't abort your fall because you have poor balance and muscle weakness. Again, pets, cats, dogs, animals sometimes sneak up on us or sometimes drag us to a fall. The results of falls for those of us over 65, for women, we have the osteoporotic-related hip fracture. We have head and neck injuries, which can certainly contribute to bleeding, intracranial bleeding, and concussion. Foosh, fell on an outstretched hand, injuries, wrist injuries, elbow injuries, and shoulder injuries as we fall and trying to brace our fall. Ribs are easily broken during a fall. Strains and sprains can never be avoided when you fall. The mental health aspects of falling, the fear of falling, and the fear of isolation institutionally and generally contribute to falls. So in the evaluation of someone who has taken a fall, again, sometimes we can give people a pass if they've tripped or fell one time, but if they've had a history of more than one fall, then we have to put them in the category of falling. And outside of the change in weathers, there's really no information that talks about falls occurring more frequently in the fall. So history and physical is the key to all medical training. The mystery is usually in the history. So the emphasis on a good history and physical can't be overlooked when evaluating someone for fall problems. Gait evaluation is important. The get up and go test, where you ask people to get up without assisting themselves and walk 10 steps, turn around, and return to their seat. Functional reach test, the single leg balance test, again, a PHQ-9 is a very important analysis for the mental health that contributes to fall safety. And the fall efficacy scale, which I've included here, talks about what happens in the activity of taking a bath or shower, reaching into cabinets, preparing meals, heavy and hot objects, getting in and out of bed, answering the door or telephone, getting in and out of a chair, getting dressed, practicing activities on one leg, personal grooming, and getting on and off the toilet all are included in the fall survey. So the now what of this discussion is important. Like anything, we have to acknowledge that there's a problem. Again, physicians that are alert to taking care of people over the age of 65 need to acknowledge that falls could be a problem. As we said, 1 out of 4 people over the age of 65 will have this problem of falling. And then modify the identified risks. What do we do once we've found risks in a patient? It could be as easy as discussing medications and their side effects or emphasizing good shoe wear. But maintaining strength and mobility and improving balance are the key hallmark to preventing falls. And this has to do with making sure that you're staying strong, getting regular exercise, 30 minutes, 5 times a week, which can be as easy as just walking around the neighborhood. But if it's snow and icy, it becomes difficult. There's a fear of falling, especially in our northern climates of Pennsylvania. But maintaining core strength is a way that we can combat this difficulty. We can't prevent falls, but we certainly can reduce their numbers. So that the harder we try, the more we reduce. But to eliminate falls completely may be a little bit of a Herculean task for this discussion. We want to try to eliminate extrinsic hazards, which we've delineated earlier, and maximize the intrinsic health status. So maintaining general health and seeking preventative care on a yearly basis is tremendously important in the incidence of trying to prevent or reduce fall. So improving core strength, how do we do that? There's classic exercises that can be used that are not terribly difficult for people over the age of 65. You can do Supermans on one knee on the ground, or bird dogs, where it looks like you have one arm stretched and one leg stretched. Doing back bridges and front bridges and planks are simplistic exercises to help improve your core strength. Heel raises, just standing at a counter on one leg is very important. And while you're doing that, raising your heels, strengthening your calf muscles and your lower muscular girdle. Wall sits are an easy way to strengthen our quads and hamstrings. Participating in Tai Chi. Spend a lot of time in China teaching their young doctors how to be more holistic in their family practice approach. And they have Tai Chi going on in every park at nighttime and at dawn. Hatha yoga is classic for breathing, exercise, and stress reduction. Even chair yoga has shown to improve core strength. Access to a swimming pool, access to being able to just not swim necessarily, but to tread water or to be in a pool and doing your exercises, because you can't really fall in a pool. Walking 30 minutes daily is an important pillar of improving core strength and balance and muscular strength, which then again eliminates the fall risk. The Otago exercise program has been publicized with great results. It has been proven to reduce the risk of falls by 34%, which is quite significant. Chair rise exercises I've included here because they're so simplistic, but more importantly, the CDC is a great reference, the STD organization for eliminating elderly accidents and injuries. So that's a great resource. If you don't take anything home from this discussion, I would want you to be able to reference the CDC's public health presentations of how to prevent injuries in older adults. So the needed adjustments once you find someone that has a fall problem is to try to eliminate stairs or uneven surfaces. Balance exercises, as we mentioned, Tai Chi and yoga, just walking is very important. Proper lighting in areas that will help to eliminate clutter. This is probably one of the more difficult things to do in your average home. We've talked about anyone hospitalized for a fall or anyone hospitalized, period, that's over the age of 65 can have a occupational safety analysis of their home. And a lot of times we forget to do that particular consultation. Again, proper shoe wear, tripping, shoelaces, Velcro, these are all the issues associated with proper shoe wear, good tread patterns, and proper foot hygiene. Medication review, your average 65-year-old is on 8 different medications that have 8 to 16 different side effects. Social interaction has been implicated in falls. So that isolationism, the fact that widows and widowers are home alone in a dark house with clutter is a grounds for a fall. Proper hydration is the number one implement of nutrition. Cautious alcohol use in the way it interacts with the medication. Good posture as we sit, as we stand, that improves core strength. Maintaining hearing and vision so that we know the surroundings and the environment and can perceive threats and hidden tripping hazards. Again, dogs and cats sometimes offer great benefit of socialization to older adults, but can also have a hidden tripping hazard. Vitamin D levels have been implicated in fall prevention and reduction. Again, hidden tripping hazards I've mentioned several times. Unnecessary medical screenings, home alert alarms as needed, access to water, appropriate vaccinations for general health, sometimes hip protector, have been implicated in reducing injury from falls. Again, the NIH, the National Institute on Aging, has a great public health presentation. So the CDC and the NIH, these are all government-funded programs that have realized that we need to try to eliminate that $74 billion potential burden on our $4 trillion health outlay per year in the United States. So talk with your healthcare provider about medications, do strength and balance exercises, get your vision checked regularly, make your home safer with night lights, grab bars, securing carpet to the floor, stand up slowly, practice good posture, using a cane or walker if you need more stability. Again, the reference to the NIH. The STD program, as I mentioned earlier, stopping elderly accidents, deaths, and injuries. 4 things you can do to prevent falls. Be open with your healthcare provider. Keep moving. There are 30 minutes of exercise or walking. Both anaerobic and aerobic exercises can be helpful to improve muscle strength and balance. Replace your eyeglasses as needed. Again, the problem of getting up in the middle of the night to go to the bathroom in the dark. With clutter, do you take time to grab your glasses? Some people don't, but clutter is a great tripping hazard. 1 in 4 people over the age of 65, as I've said before, will fall each year. So you can also contact your local community or senior center for information, exercise, fall prevention, and options for home safety. And there's references to that program. And this also allows you to stay independent for as long as possible. Postural hypotension received its own brochure. Orthostatic hypotension is when your blood pressure drops when you go from lying down or sitting up, from sitting to standing. When your blood pressure drops, less blood can get to your organs and muscles. This can make you more likely to fall or be dizzy and potentiate a fall. The Home Safety Survey, which is also part of the STD program, breaks down what to do about stairs and steps, about floors, bedrooms, bathrooms, kitchens, all little things that might help your average 65-year-old to prevent a fall, or at least reduce the potential for falls. Such thing as uneven steps, light bulbs, carpet, handrails, rugs, tape. Certain issues can certainly help in the bathroom. Keep things you use often on a lower shelf. Certainly do not use chairs as an aid to get something out of that top drawer. Place a lamp close to your bed. Night lights, emergency action alarms. There used to be just 1 or 2, and now there's a myriad of safety provisos that are available. Non-slip rubber mats or strips for steps, grab bars. Difficult to exercise outside when there's snow and ice because of our vision or our balance. We didn't see the black ice on the street. And again, men are more likely to fall in an attempt to exercise or do chores around the house. They're more likely to fall outside, where women are more likely to fall inside. Some of our resources that are available are listed here. The National Resource Center, Rebuilding Together, Centers for Disease Control, the National Center for Injury, and the STD program for the NIH and the CDC. Thank you for joining me. Learn about fall prevention. Again, the important issues, the nature of falls, the changing and aging demographics, emphasize the cost, the $74 billion potential yearly cost of falls. And we've discussed numerous ways to prevent and reduce falls. And don't forget to initiate safety analysis by an occupational health specialist when discharging a person from a hospital. So again, this podcast episode is eligible for CME credits. To claim your AOA Category 1B credit, visit the web page noted in this episode's description or visit the POMA podcast page on the POMA website. I appreciate your attention and hope you have a pleasant fall. Thank you.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.